When documenting order management, you can go in and place orders under a doctor's name. You have written, verbal, telephone, or protocol orders. The most used are going to be the verbal and telephone when you're putting them in. Once you select the type, verbal, you need to make sure that you are using the correct order time. That is the time he actually gave you the order. You can change this. It will always default to now. Click on that field and you can change the time here. So if he actually gave you the order at 10 o'clock, you can go into that particular field, highlight it, and type in the time. Click OK, and you can then enter the order author, whoever it is that gave you the order. It will always default to the attending at the top, which is Dr. Evna Shahidi, but you can always type in whatever doctor's name you're looking for. So if Dr. Calvin gave me the order, I can type in his last name, hit enter, and select him off the list. Click OK, and click OK in the bottom right hand corner. It will then drop you into the order selection screen. You can use order sets. OB has a set of order sets that they use for specific types of patients. Nursery has theirs, surgery, general order sets. These allow you to click off of the list instead of having to type in the names of all the orders you want. You can click, for instance, on critical drips. Click Add Order in the bottom right hand corner, and it will give you a list of some critical drips with the instructions as well as the dosing listed already. They are already populated. You don't have to add anything else unless it's a field that is empty, such as this one with the line, letting you put in specific information it's asking for. You can just click on the box to be able to select, and then you're able to click on Add Order. Once you do that, you're able to view all the information, including all the specific instructions. You can make changes at this point. If you needed to change the dose or the route, the frequency, you can make changes if you click into those fields. If you're good with what's on the screen, click the Read Back button. This then tags it to show that you did a read back on that particular order. Click OK, and it will put it to the top of your screen. All orders that you put in, whether they are new, discontinued, or change orders, will all go to the top, displaying what you have ordered. You can also place orders using the Search tab. If you click into Search, you can type in the test or the orders that you want to put into the ordering system. So we can abbreviate some things like CBC. Always separate with a comma. The next item I want to order is a BMP, comma. I want to order some medication, and I'd like to order a chest x-ray. Chest x-ray you can abbreviate with the CXR, or you can just type in chest. Either way, it will bring up everything that comes with chest. When you're ready to start entering the orders, hit enter, and it will start walking you through each item separately. So the CBC, when I type it in, comes in with 3 different options. The usual one is the CBC with auto diff. I can then put in what schedule I want for it. I want it in the morning or daily, or if you want an order at a specific time, the lab can be done at a specific time if you enter number 7 and designate the time. I'm going to schedule this for tomorrow in the morning. Again, I do my read back, enter, and it will put it right up here. The next one is my BMP. Again, I put in when I want it ordered. I do my read back. There's nothing else I need to fill out up here except for the frequency. Everything else is filled in. And OK. Next is my Ativan. When ordering medications, we use a screen called Typical Orders, where you're able to use some of the typically ordered routes, frequencies, and doses. It will also give you options for entering your own frequency by putting the little open line here. Here are the routes separated out. If you pick one of these, you can click on the radio button and hit add order in the bottom right hand corner. It will then open up and display for you all the information. At this point, if you would like to change anything about the order, you still can. Ordering off the typical orders is not set in stone. You can change the dose, you can change the route, and you can change the frequency. If you wish to put in any instructions, this is a free text field. It is not required, and it is not bolded, so you can see that you can just start typing in here if you want to. And this does display in the nursing documentation of medications. Click my read back, I hit enter or OK, and I move on to my next item, which is the chest x-ray. If I double click that, it will then ask me for what type of chest x-ray I want. 1 view, 2 view, portable, etc. Most of the radiology procedures let you designate the details once you have placed the order itself. So I'm going to make this a 2 view, and then you would go ahead and put in what indication you're looking for. Why are we doing this test? Pick off the list, and when do you want it done? It will default, if you put today, to the time now. And do my read back. Okay, and it puts it up here at the top. When ordering medications, you may or may not want to use the typical orders screen. For example, I'm going to go into the Cinepril, and my only options are for an oral route. I'd like to be able to give this to the patient via tube, so if I use the order profile tab at the top, right next to the typical orders, it then allows me to build out the order the way I want. So if I want this to be administered via tube, I've got an option here, number 7, and then I can go ahead and enter the number of milligrams. Then I can put in the frequency. If this is an everyday medication, I have number 17, every day. And I can do my read back. Okay. I'm going to order aspirin on this patient, to which she is allergic. When I open it up, it still lets me go in and place the order. So if I want to give her 81 milligrams by mouth daily, I can go ahead and double click that. And it will open up and fill it in, do my read back, say OK. You'll notice that after I do that, I get a red triangle. The red triangle is a hard stop. You will need to address this issue before you are able to file all these orders. This one is a yellow circle. You're notified that this may be a duplicate therapy. If you hover over it, it'll tell you what it's warning you about. The yellow circles are not a hard stop. You are still able to go ahead and order these, but it is at least letting you know that that is a duplicate order. The red triangles are hard stops. I can deal with it in this screen, or when I'm ready to place my orders, I go to Order Summary in the bottom right hand corner, and my red triangle still needs to be addressed. If it has not been addressed, I will not get an Accept Order button at the bottom. It is grayed out and it does not let me finish my orders. So to address the red triangle, you have to double click the item to open. It will then tell you what the reason is. This patient has had a prior adverse reaction. Her allergies, she has an allergy to aspirin. It tells you what the symptoms are, and it allows you to either continue taking this medication or you can discontinue the order. If you want them to go ahead and take it because the benefit outweighs the risks, you can pick whichever is appropriate, and you will get a little check mark on the triangle. You also now have access to accept the order. If you decided that it needed to be discontinued, you can select it and you can remove order from the list. If not, just go ahead and accept. once this files, I can refresh my inbox, and I now have 13 orders I can then sign off on. I can do my select all and sign review, and they will disappear. Close my inbox. I'm going to go back into order management, verbal order. I will leave the time as the current time, pick Dr. Edna Shahidi as my order author, and click OK. So you can use the order selection screens. You can use the search tab to type in whatever information, whatever orders that you want. You can also use the order history tab to allow you to put in any changes or discontinued orders. To discontinue any orders on the patient, you will click on the order once, and you will get a discontinue button down at the bottom. Click discontinue. When do you want it discontinued? Now is fine. I can go ahead and say OK or enter. OK one more time. Do my readback. And it puts it up at the top that I am discontinuing this particular medication. There's my discontinue type here. You can do discontinues and changes while you're putting in new orders. You don't have to put them in different sessions. You would just click into whichever tab that you need to do the order. To change any dosing or frequency on any medication or order that's in the system, click on the medication or order, hit change, and we want it to be now. That's fine. And we can go ahead and click into the part we want to change. She's going to actually get 2 milligrams by mouth. Do my read back and OK. And now it says it is a change order instead of a new order or discontinue. If you put in an order, such as for a diet, you can select diet and then define what type of diet that you want this patient to be on. Let's say that we want them on a 2,000 calorie diabetic. If you have multiple items to designate, you can click on as many things as you want on here. Click OK. If you forget to do your readback, which I'm going to do right now, I'm going to click OK. When I go to my order summary, it will make me go back and do my readback. It will not give me my accept order until I actually address the readback. I'm going to click that. It takes me to the specific order that did not get it done. Read back, OK, and now I can accept my order. The next thing we're going to go over is the home medications and the consolidated med list. So when you log in to put in an order, again, define the order type, time, and author. Click OK. And you can go to the 4th tab over called the consolidated medication list. These are the patient's home meds designated with an H. These are their visit meds with a V, and we haven't entered any discharge meds yet, so they are empty. But these are your home medications and your visit. You can copy any of the home meds into the visit meds if that's necessary. Instead of having to enter them one by one, you can select them either one at a time, or you can multi-select holding your control key down. You can multi-select any of the orders. So I have 2 home meds I want the patient to go ahead and continue on while they're here in the hospital per the doctor, and I can multi-select and say copy orders down in the bottom right hand corner. Because this is an antibiotic, it's making me put in a reason for the medication. I'm just going to give a random choice, and this is read back. OK. And it will take me to the second item, which was the digoxin. Again, I'm going to go ahead and do my read back and OK. And it will put it into the system as if I had entered these in by hand, but I just copied them from the home meds. Save you some time for having to enter those one by one. You continue to save them just like any other order summary, and accept. When the patient is ready to go home and there is an order for a discharge on the patient, you can go in and take care of the discharge meds if they haven't been done, or you can also add or edit if you need it. So you would still put in whether it was verbal or telephone, order time, and author. Click OK, consolidated med list, and you can continue the patient taking their home meds. You can also copy any visit meds to become discharge meds. So the first thing we'll do is having the patient continue some of their home meds. I'm going to have the patient continue their digoxin. So I will select it, click once, and you click copy to discharge meds. It will then show you the information. No prescription is required because they're just continuing the previous home med. Click OK and accept. Then you can see the medications down below as they start populating. When entering discharge meds, you always start with the ones you want to either start taking, continue taking, and then you can enter the ones you don't want them to take anymore, to stop taking. So for instance, the amoxicillin, I don't want them to take that one anymore, so I'm going to click it once, and you'll notice that I now get a button called Stop Taking Home Meds. This will not appear until you actually initiate the home meds you do want them to take. So if you need them to stop taking any of their home meds, wait to do that as the second step. Once you don't want them to take this medication, you can select the med, click Stop Taking Home Meds, and what's the reason? Maybe the therapy was completed, maybe a physician ordered it that way, or maybe they just had a change in treatment. Once you do that, you say OK, accept. And once it comes back, you'll notice that nothing changed with the discharge meds, but you'll notice up here where it says amoxicillin, it does have a stop date of today. If you want them to continue taking any visit meds, you can select the visit med, say copy to discharge meds. Again, it will ask you for a medication type. Since this is not their previous home med, we will need a prescription. And then you would need to put in the quantity. And accept. We do want to make sure that these home meds are put in as discharge meds or continued or new ones added, so that when they come back for the next visit, these discharge meds will actually become their new list of home meds. So it's as up to date as we could possibly get it. If the medication is a new medication that is not on this list, you can click on the button called Add Discharge Med. That will allow you to put in whatever medication name and frequency and dose you're looking for. So if the patient is going to go home on amoxicillin, I would type it in, hit enter, and it will give me all my choices for what medications I can choose from. If I'm actually going to give them Augmentin, it will also display the combination drugs down here as long as it started with amoxicillin. So if I decide I want the patient to take Augmentin 875/125, I can select it. Then I want to go ahead and say a prescription is required, and I want them to take 1 tablet by mouth. Then I can define how many days or in how many hours I want them to take it. So they're going to be taking this every 12 hours, and I want to limit the number of doses by using the X in number 12. I can enter the number of days, 10 days, and it will limit it. Any instructions you can enter here, and the quantity, so I would need 20 pills. Hit enter until you get an accept. You'll notice at the bottom in the discharge orders you do get a D or a DRX. The D is because this was a copied home med. The DRX means that this is a new discharge med that is going to require a prescription. Then you can actually call in the prescription if the doctor has not sent it via e-prescribe. Usually the physician will put in the discharge order, but if you take a telephone or verbal order for the discharge, you would need to also, besides the medications, put in the discharge patient order. You can type in discharge, and you've got discharge patient right here. You would need to answer a few questions. You would need to know what their principal diagnosis is. You can either pick off of the list or you can enter free text. If they had an additional diagnosis, you could enter that, but it is not a required field, so we can hit enter to go past it. Discharge type, where are they going? They are going either home, or maybe they're transferring to another hospital, or maybe they're going to a skilled nursing facility. Depends on what's going on. I'm going to say home. You would also need to know what type of diet they're going home on. You can pick off of the list. And if they're going to resume normal activities or have any limitations. Any problem signs or symptoms to report. If they have chest pain, difficulty breathing, maybe if they have a temperature, they can pick that. If you have a patient who's COVID-19, we do have a set of instructions that cover a pretty good amount of information. When do you want them to follow up with a primary care provider? You can also define in days or weeks. Also, if they have a second physician they need to follow up with, you can select it and define the name of the physician. Here's a list of some common physicians, but you can also start typing and when do you want him to go back, for what reason. You can also put in what kind of referral, if they have home health or if they need a walker, oxygen. If not a required field, you can actually skip it. Any special instructions you can put into this field. If not, just hit enter and do your readback. Say OK and order summary, accept. Once the discharge order has been placed, you will see on your work list you have a discharge patient, discharge preparation, and discharge medication list. The 3 items need to be done. Usually the preparation is done first, then you can print out the medication list if it is complete, and that is something you can give to the patient. The discharge preparation is actually what populates our discharge instruction report that we actually give to the patient, but you can run the discharge medication list at any time. When running the discharge medication list, you would open up the procedure, click on document, now is fine, and it's going to run the report that you can then print out and give to the patient. Make this bigger. The benefit of this is it will show you to stop taking certain medications when they leave. You'll see it's crossed out, it tells you stop, and it tells you stop on the right side. You will also get a section for continue taking the following medications, which is that digoxin they were on before they got here. And when they have new ones, it will say start taking these medications. It has the information the dosing, and the route and frequency. And it will say on the right hand side that this is a new medication. Here's your print button. You can click print and then click OK and accept to finish out that particular report. Once you're done, it will disappear off of your work list, and now I just have my discharge prep and discharge patient. Discharge preparation, open that one up and click document. All of the ordering information that we have crossing into the documentation side will cross, so you don't have to retype everything. Click document, now is fine, and it will drop you into the other fields that didn't get filled in. So we did not put in additional diagnosis on the last one, but you can see that that principal diagnosis did cross over. So I'm going to go ahead and hit enter because there's not an additional diagnosis. Are there any pending studies at discharge? You would go ahead and say no studies pending, or yes there are, and you would be able to say which ones they were. If the patient is Spanish speaking, you are able to also include Spanish interpretation of the English version. And we put them one on top of the other so you know this goes with this particular entry. You can put both English and Spanish, or if you want to just put Spanish, that's fine too. You would then be able to put in who their PCP is and if they have a phone number. If they don't have one, it is not a required field. You can actually go past it and click enter. This is also going to have you look at the med reconciliation report. If the meds have been done ahead of time, this report will already be populated and you won't need to fill anything out, which is the benefit of doing that first. So here's what the report looks like. You can see that this has my pre-admission, visit, and discharge meds, and all those discharge meds we put in are listed in that particular column. We would not alter this in any way. All you have to do is say submit. It will then finish and take us back, and we can continue to document. Did you call in any of the medications? If you did, then you need to document which pharmacy you called it into. If not, just click no. Any prescription instructions, pain management instructions? If not, just hit enter. What is a good callback number? If the patient had a telephone listed from when the admission was done, you would be able to see it up here at the top, or you can ask them and they can go ahead and give it to you. When is a good callback time? Any instructions or discharge instructions you might have given to the patient, any education, you can go ahead and select who you gave it to. And if they have any issues with actually learning, if they have no problems learning, you're going to pick number 1. If not, then you're going to pick anything right below that. That way you don't have to complete that if you can't do any education with the patient. You can document the area of instruction. You have some predefined information here, or you can just simply enter free text if you have specific information you taught them. If you used any kind of explanations, printed handouts, just pick whichever is appropriate, and you can document the readiness. If not, just hit enter to go past it. And how did they respond to your teaching? Maybe they were able to verbalize but need reinforcement. You also have access to enter documentation from Lexicomp, and you would go ahead and select medications, and it will give you a list of the medications the patient was actually on, or for their visit, or as part of their discharge meds. You can select the medication, select it again. It may take a few minutes for it to complete, and when you're done, you would be able to see what teaching it's going to give you. Now, since we said this patient was Spanish speaking, it gave us our Spanish instructions. I can go ahead and close this using this little X here and say OK and OK. You can also pick off of any of the other education websites. These are all connected. Once you file, then it will print out the actual instructions. We don't actually have a print button within here, but if you selected creams, for instance, and you type in something for them to take home, you have, for instance, stroke. If you type in the word stroke, hit enter, it will come back with both English and Spanish. It also gives you a list of different subjects that you could pick from. I have stroke self-care. You can simply file this by saying OK to get to the next screen, or if you wanted to actually view what it says, you can double click and it will display on your screen what it's going to print for the patient. I'm going to go ahead and close this one, say OK, OK one more time, keep going, and it moves me on to enter the document vital signs. You can also put any referrals that didn't get put in earlier. If they need to be added, you can. And again, you can put English and Spanish or either or. Does the patient have a wound or ulcer? Yes or no? If you say yes, it's going to then ask you, did you take a picture of that wound or ulcer before they leave? It's a yes or no question. Then it drops me into my flu vaccine status. So if the patient did not receive a flu vaccine at the admission or anytime during the hospitalization, you would need to then go ahead and document again what happened, why they're not getting it, and since this is July, it is not currently flu season. The pneumonia vaccine, this was actually ordered for the patient, and I could have documented that it was actually given. If it had been given and documented on this visit, you would be able to see last given, and you would also be able to see if they had documented that it was last administered on any previous documentation. Once you're done with your entire discharge preparation, click Accept. That too will fall off of your work list, and what will be left is your discharge patient right here. Do not process this procedure until the patient is actually out the door. If there's anything that you need to catch up on charting as far as medications or any other charting, it's better if you wait till they're actually out the door, because if something changes, you can keep them in the system. Before they leave, you would print out that discharge medication list we did earlier. You also have your discharge instructions here. Now, there is a little arrow. You can click on that. The first one is your patient instructions in English. Your second one is the patient instructions in Spanish. You have OB instructions here in English and Spanish, and you have PEDS instructions in English and Spanish. So whichever one is appropriate. If you forgot to enter any kind of Spanish discharge instructions, click the expand button and go back into the discharge preparation. You can do this if you forgot anything, if you need to update anything. I'm going to go ahead and go back to correct my document, and I can scroll down and update any information. So for instance, if I wanted this information in Spanish, I can change the diet to read in Spanish as well as English, or just in Spanish, whatever is appropriate. It will still show what was actually entered by the physician, so you can see what he picked and just pick the Spanish version right below it. You can do this while you're actually documenting it. You don't have to go in to do it as a correction, but if I forget, I can always go back and change it. Here's my COVID instructions in Spanish. It does not change what the physician documented. This is simply for the documentation side and will appear on the patient's report. Once I'm done, I can hit enter and accept, and then I can go to my discharge instructions, open that up, and select the Spanish version. The Spanish version, go ahead and click accept. We'll just also have all the headers in Spanish, so it's easier for the patient to read if that's their language. Here we have our discharge instructions. It will also display the medications. Unfortunately, this information here does not display in Spanish. The header does, but this does not. So you're able to see all the rest of the information in Spanish. The second page is supposed to be for the physician, and they can take that to their physician to be able to review what was done. The third page is actually the signature page. You would go ahead and have the patient sign this. You would sign it, and if there is a packet, you can go ahead and have a second nurse who verified that this was the correct patient, so we don't accidentally give other patient information to the wrong patient. You have the print button right up here. Once you hit print, go ahead and send it and click OK to close it and finish it off.